Hello everyone in W3 and welcome. Welcome to our special population presentation titled Telehealth in the Elderly Population. My name is Kaylee Wright, and alongside my fellow group members Ashton and Maggie, Group 41 as a collective unit has come together to provide ample research and reasoning as to why telehealth has become such a prominent figure in the general care for elderly patients in the United States. The United States has a growing number of elderly and aging adults, typically aged 65 years or older, who are living longer than past generations before them. According to the United States Census Bureau, older Americans will make up more than 20% of the United States population starting in 2030, just 7 years away. The elderly population experiences numerous barriers, both financial and physical, that constantly keep them from getting the proper care that they need and deserve. Of these barriers, some coincide with the cost of medical bills and various forms of different insurance, as well as difficulty finding proper forms of transportation both to and from these medical appointments that they truly can rely on. When analyzing elderly populations, we have come to find a greater sense of vulnerability within these aging adults compared to those much younger than them. Vulnerability is the outcome of complex interactions of various risk factors, such as being exposed to specific threats, that contribute to the utter lack of resources that this particular population is able to use in order to defend themselves against these threats. We have found that there is a growing number of elderly and aging adult patients that are living longer than past generations before them. This particular aging population experiences more chronic conditions and comorbidities than younger populations. Thus, there is an increased demand for specialty care for this particular population, as well as a need to address the challenges faced by this population in accessing both affordable and high-quality care. By the time you have reached 65 years or older, average healthcare costs are nearly triple the annual average cost of when you were in your 20s or 30s. If out-of-pocket costs for healthcare services are not affordable, some older adults will and have postponed non-urgent care or forego it completely. Not receiving timely care can worsen health conditions, delay diagnoses, lead to poorer health outcomes, and can increase the overall healthcare spending of the individual. This is where telehealth comes into play. Telehealth, aka telemedicine, is a form of care that allows healthcare providers to care for their patients without your typical in-person going to the office visits. These visits are primarily online and conducted over one's computer, tablet, smartphone, etc. With a variety of options as to how one meets with their healthcare provider or caregiver, such as live chats on applications such as Zoom or Skype, or sending and receiving messages over proper, pre-approved messaging channels, telehealth has become extremely popular, especially since the beginning of the pandemic. Since the year of 2020, there have been clear signs that patients were in dire need of a different way to visit their physicians and other caregivers remotely, from the comforts of their own home. Telehealth has proven to be extremely effective as it has helped elderly patients in terms of ridding of issues with transportation to and from their appointments, relieving any and all stress that comes with the process of scheduling an appointment and making it there on time, spread of infection, and in terms of allowing these patients to be seen in a more natural, comfortable environment for them and their personal well-being. With all of these said, I would like to hand it off to Ashton, as he will go into further detail regarding the overall benefits and drawbacks of the drastic increase in telehealth usage seen in elderly and aging adult populations since the pandemic. Thank you.
Hi everyone, my name is Ashton Bowling from Group 41 in W3. I wanted to start off with a general statistic that we found about current usage of technology among the elderly population, which is those 65 and older. According to a recent study, approximately 61% of older adults have and utilize a smartphone. Smartphones were introduced about 15 years ago, so this statistic is a good indicator of how telehealth could grow and be utilized by this population within the next decade or so. So now that we have a better idea of what makes the elderly population so unique and what telehealth is, let's discuss the benefits of this technology. What some might consider to be the largest benefit is the overall cost savings that telehealth offers. Telehealth can reduce the amount of times that people need to visit the emergency room or be admitted into the hospital. This is because of the greater accessibility that telehealth offers. As Kaylee mentioned earlier, this population is incredibly vulnerable to disease. If someone is noticing some mild symptoms pop up, they could book an appointment with their provider no matter where they are. They could be visiting grandkids, taking a vacation, and still be able to meet with their specific provider. This ensures that the patient can receive care early so that their symptoms don't worsen over time and develop into a much more severe illness. Telehealth also allows for less trips outside of the home, which reduces disease exposure. And one of the other benefits that I touched on earlier but wanted to mention was the greater access to healthcare services. Some of the biggest barriers to receiving healthcare with this particular population is transportation. Telehealth completely abolishes this barrier since people from this population can meet with their physician from the comfort of their home. New technology is always something that comes with pros and cons. Just like when we show our grandparents how to use their new phones, there will be a learning curve for this population as they adjust to the new technology. We have to be able to mitigate the general technical difficulties that this new technology brings. Like we saw during the pandemic, there was a lot to get used to when it came to living our daily lives and completing work in a virtual space. Another piece we need to be mindful of is that people from this population may take virtual healthcare as impersonal. It will be vital for physicians to emphasize a relationship with their patients. Another aspect that healthcare clinics will have to be sure to protect is patient information. No platform is 100% safe from hackers and data breaches. Telehealth systems will have to be encrypted and be completely private in order to maintain HIPAA laws. Telehealth rules and regulations vary greatly state by state and are constantly emerging and evolving, so there may present a need for federal regulations in order to maintain a cohesive system. I also wanted to mention issues with Medicare. As we all know, Medicare is primarily for adults 65 and older and is federally controlled, unlike with Medicaid, which is controlled by the states. With telehealth, there is a lack of significant reimbursement from Medicare. The 2018 Bipartisan Budget Act represented significant legislative advances for Medicare's telehealth policy. This offers potential to expand access and improve quality of care for Medicare beneficiaries. And this is not only for those with chronic conditions, but also for those whose morbidity or mortality could be reduced by early interventions, such as patients with heart disease or stroke. And finally, to my last point, telehealth does not offer physical examinations, which goes to show that telehealth will not be a full replacement for in person care. Instead, it's going to be an additional resource that physicians or other healthcare professionals can rely on top of normal care. And this is something that Maggie will touch on in the implementation section of this presentation. Thank you.
Thank you, Ashton, for discussing the overall benefits and drawbacks of increasing telehealth usage among the elderly populations. My name is Maggie McTague, and I will be furthering our discussion on telehealth for the elderly by diving deeper into ways to improve the implementation of the telehealth usage for the elderly population. According to telehealth.gov, older adults may be less comfortable using a computer or smartphone, or they may experience physical or cognitive barriers that reduce their ability to access telehealth, such as limitations in hearing, vision, or cognitive impairments. These unique set of challenges may be addressed in a few particular ways. In order to make telehealth usage better for the elderly populations, it is important to consider what challenges the elderly population may face and how to address these challenges. A couple ways my team and I came up with are using a bold font, simplifying the design of the telehealth platform, whereas there's not too many options to click on, educating the patient and the family members of how to use the telehealth platform and asking for assistance when needed, and also assessing the needs of the patient. Would telehealth work best for this patient, or would in person care be better? It's important to address the needs of each patient and address their individual needs and desires for what they're looking for in their care. As a healthcare provider, if you can see that a patient has trouble using their hands, or they can't access or they don't have the cognitive skills to be able to navigate these platforms, we may recommend a simpler technology such as using emails or phone or receiving assistance from a family or a caregiver. Now, on the other hand, if a patient can't drive to their appointments and is struggling to get to in person appointments or get that care in person, it is important to assess the benefits of telehealth care for this person. And maybe they may benefit if they don't have trouble with cognitive function or using their hands, or there's someone nearby in the household who is able to assist them with accessing these services. There are other options though, such as, again, the phone calls or email. But telehealth is a unique way to have that direct contact with the provider, but you're not having to go in person. And a lot of elderly people struggle with driving. So, this is a really unique and beneficial way to deliver healthcare to the elderly and for people who may not have a doctor near them or be able to reach a doctor and they want that face to face connection. Another aspect to consider is that the elderly may need monitoring devices that are remote. So they may need blood pressure monitoring devices or a heart rate monitoring devices if they're not able to go in person. So this is an important thing to discuss with the patient and see if they're okay with. Overall, my teammates and I have discussed the current barriers to care for telehealth, the vulnerable nature and need for extra assistance in the elderly population, emerging and existing issues in the elderly population, the benefits and drawbacks of telehealth, and ways to improve these designs. Ultimately, the elderly population faces unique challenges, and many elderly people can benefit from the resources provided by telehealth, with improved designs and extra assistance from those around them. While not everyone can benefit from telehealth, it plays a critical role in delivering care to those who may not benefit from in person care. Thank you and have a wonderful rest of your day.